SURE stands for Substance Use Recovery Evaluator, and it measures recovery from alcohol and other drug dependence. It is psychometrically valid, quick and easy to complete, and it's been developed by researchers, clinicians and people in recovery from a substance use problem. In this short video, I'm going to explain a little bit about what SURE is, why we have developed it, how we developed it, and how you can use it. And I'll also say a little bit more about why SURE is different from other measures of substance use and dependence. In other words, what is unique about it? So what is SURE? SURE comprises 21 questions that together measure 5 core components of recovery. These 5 core components are drinking and drug use, self-care, relationships, material resources, and outlook on life. The person completing the measure is asked to think about the last week and rate themselves on each of the 21 questions. Each question scores 1, 2 or 3, so it is possible to score between 21 and 63. Now this may at first seem like an odd scoring system, but it isn't really. There is no such thing as zero recovery, and so no such thing as total recovery. So we don't actually need a scale that scores 0 to 100. Okay, why did we develop SURE? Well, I guess we were getting a bit frustrated. Everyone was talking about this concept, recovery, but nobody could really agree on what it was. Recovery was the new treatment goal or treatment outcome, yet nobody could define it. At one point, this had become quite destructive, with some people arguing that recovery was only about abstinence, and others arguing that it needed to include harm reduction. Neither side seemed to be listening to the other, so we wanted to be a bit more constructive. To us, it made sense to go back and start nearer the beginning. So we asked people who used alcohol and other drugs what they wanted from treatment and what recovery meant to them. We then used their responses to build SURE. Not surprisingly, we ended up with a measure that has questions about substance use, but also about mental and physical health, diet, sleeping, daily routines, relationships, housing, income, hopes and goals, and so on. So how did we develop SURE? Of course, developing a measure of recovery is not as simple as asking a few questions, asking a few people to brainstorm some indicators. If an outcome measure or assessment tool is going to be useful, it has to be valid and reliable. In other words, it has to measure what it says it measures, and it has to do this consistently. This requires psychometric testing, which is a bit of a statistical specialism. So it soon became apparent that we would need quite a large team to work collaboratively if we wanted to make SURE as good as we possibly could. Our team comprised academics from King's College London, service users from the Aurora Project, which is a peer mentoring service in Lambeth, London, and clinicians from the South London and Maudsley NHS Foundation Trust. We were funded by the National Institute for Health Research Biomedical Research Centre for Mental Health at South London and Maudsley NHS Foundation Trust and King's College London. And we conducted the work in stages, taking the best part of 3 years to complete. First, we developed the measure using Delphi groups with clinicians, focus groups with current and former drug and alcohol service users, and cognitive interviews with current and former service users. We also took on board extensive feedback from service users, and our Service User Project Advisory Group provided input at every stage. Then we got a much larger group of current and former service users to complete the measure, along with some demographic questions and 2 other related validated measures, so that our statisticians could assess the psychometric properties and factorial structure of our new measure. This resulted in the 21 questions. We again checked with service users who confirmed that the 21 question measure retained good face and content validity, and then service users helped to identify the name Substance Use Recovery Evaluator, or SURE. If you're interested in the methodological details, these are all written up in our article in Drug and Alcohol Dependence published in 2016, which was called Development and Validation of SURE. So the next question is, how can you use SURE? Well, the first thing to emphasise here is that we really do want you to use it. SURE is free to use for non-commercial purposes. So if you are someone who uses substances or consider yourself to be in recovery, you can just use it. If you work in a not-for-profit treatment service or healthcare setting, you're also welcome to use it. And if you want to use it to generate profit for yourself or for a company, then of course you need to contact us to get a license. Beyond that, there are 3 key things to remember. Number 1, SURE is completed by the person who is using or who has used substances. The clinician or drug worker should never complete SURE for them. Of course, you can help someone to complete it, for example, by reading out the questions, but you must never complete it on behalf of someone else. Number 2, when completing each question, the person should think about their experiences in the last week. This will help them to see changes in their scores over time. And number 3, ideally SURE should be completed regularly, maybe every week or 2 weeks or a month, in order to see how the recovery journey is progressing. Once you've grasped that, it's easy. There are 4 main occasions when you might want to use SURE. First, somebody who is using substances can just complete it themselves. People have told us that they find this interesting, and it can help them to reflect on their lives and where they're going and what they want to do in the future. We've also been told that it can help people recognise when things are sliding backwards for them, which can then potentially trigger them to seek support. So SURE can be used as a form of personal self-monitoring. Second, clinicians or drug workers can use SURE therapeutically with their clients. SURE offers more than just a numeric score. The questions can and should trigger discussions about what is going on in the client's life that might be affecting their substance use. There is also a section at the end of SURE, section C, that enables clients to identify what issues are currently important to them. This should help a worker better understand the client, their broader life circumstances, and those issues that they are currently most motivated to address. Used in this more therapeutic way, SURE can inform client counselling sessions and care plans. Third, services can use SURE as part of their routine monitoring. This may be especially useful in helping services identify clients who might still be using substances, but making positive changes in other areas of their life. They might be sleeping better, eating better, having a good daily routine and feeling more positive. These are also important outcomes, but often overlooked by services, commissioners and policymakers. SURE provides services with a structured way of capturing gains that are often missed by other routine monitoring data. Fourth, SURE can be used as an outcome measure in research. If you want to assess the effectiveness of an intervention, for example in a trial or maybe in an observational study or as part of a mixed methods process evaluation, then we can use SURE for that too. For example, we could see how somebody scored before entering a particular treatment and then 2 months later. In short, SURE can provide a simple score, but it can also be used to stimulate more in-depth and therapeutic discussions with clients. Equally, it can be used instead of existing outcome measures or in addition to them to give a fuller picture. So is SURE different from other measures of substance use and dependence? Yes, we believe it is. As I've already explained, it was developed with current and former alcohol and other drug users, and so it looks and feels different from other outcome measures. It measures what is important to people who use substances themselves, rather than what is important to service providers, clinicians or researchers. It also captures a broader range of areas of life than most treatment measures, so it can help us capture softer or more intangible outcomes, as well as reductions in substance use. And very probably because it was developed with service users, it is focused on positives rather than negatives, what people have rather than what they lack. It is, in other words, asset-based, and service users often tell us that they find completing it empowering, motivating, and actually enjoyable. Having said that, we're not suggesting that everyone was going to love it. Realistically, someone who is not motivated to change their life is not going to be interested in completing any measure. We also recognise that we completed all of our developmental work and psychometric testing in the UK, so SURE may not be as useful in different countries and cultures. It might also work less well in residential settings or prisons, where, for example, someone's responses to questions about their sleep or diet or income are determined by the treatment structure. However, overall, we've been both surprised and delighted with the overwhelmingly positive response we've received to SURE since we made it available in 2016. The measure is already been widely used in services across the UK and in many other countries around the world. And there is translation and validation work going on in Italy, Spain and Argentina. Of course, we're also delighted that there are now Norwegian and Danish translations. We are continuing to roll out Sure in different formats, and we are keen to hear who has been using it and how they found it, so that we can share learning with others. If you are using Sure, please send us any feedback by email, or follow us on Twitter @Sure_recovery.